Welcome to Clinical Pathways. In this video, we will provide an introduction to clinical pathways, including what they are and how they function to provide quality care to the people of Saskatchewan. The Saskatchewan Health Authority's vision, mission, values, and philosophy of care reflect the organization's standards and guide the objectives of clinical pathways. We acknowledge that we are gathering on Treaties 2, 4, 5, 6, 8, and 10, Cree, Dene, Nakota, and Saulteaux territories and the homeland of the Dakota, Lakota, and Métis. In this video, we will discuss the following components. What is a clinical pathway? Purpose of clinical pathways. Benefits of clinical pathways. Individuals involved in a clinical pathway. Settings clinical pathways are applied. How patients may access a clinical pathway. Within the Saskatchewan Health Authority, a clinical pathway is defined as a standardized approach for patients and providers to navigate and manage specified clinical conditions from prevention through to assessment and clinical management. A pathway includes the patient journey as well as the care provider's clinical processes that support the management of all aspects of the patient care plan. By enhancing standardization, this means that patients receive the same standard of care, regardless of their location or what provider they see. As a result of reducing variations, clinical pathways address disparities in access, quality, and outcomes of healthcare and improve the engagement of patient and family partners, and the information that flows from the health system to the patients receiving care. In a clinical pathway, the patient's journey is reflected in 3 stages: prevention, assessment, and clinical management. Prevention refers to the range of activities and interventions aimed at reducing the occurrence or progression of diseases, injuries, disabilities, and other health conditions. This can include preventing the onset of a disease or condition, early detection and treatment of a disease or condition, or reducing the impact of an existing disease or condition. Assessment refers to the comprehensive process of gathering information about a patient's physical, psychological, and social health status. This information is used to understand the patient's current health status and formulate a diagnosis or treatment plan. Clinical management refers to the process of planning, coordinating, and delivering healthcare services to patients. This can include developing personalized treatment plans, coordinating aspects of care across healthcare providers and settings, and monitoring the patient's progress and response to treatment, making adjustments to the treatment plan as needed. Having clear, evidence-based steps for prevention, assessment, and clinical management helps to enhance standardization and reduce variation in the care patients receive. Pathways are also valuable tools that are evidence-based, patient-centered, and aligned with SHA's vision, mission, values, and philosophy of care. Standardized care pathways can improve patient safety by reducing the risk of errors, adverse events, and complications through the consistent application of evidence-based practices. Pathways support quality improvement initiatives by providing a framework for measuring and monitoring outcomes, identifying areas for improvement, and implementing best practices. They can also facilitate smooth transitions of care between different healthcare settings, for example, hospital to home, or primary to specialty care, by providing clear guidance for ongoing management and follow-up. In settings where resources such as hospital beds, staff, and equipment are limited, clinical pathways can help optimize resource utilization by standardizing care processes and reducing unnecessary interventions or delays. Clinical pathways are centered around the patient, with a multidisciplinary team participating in their care, including physicians, surgeons, nurses, pharmacists, social workers, dietitians, physical, occupational, and rehabilitation therapists. Policymakers, healthcare administrators, and support staff also help to facilitate pathway processes. Furthermore, the development, implementation, and sustainment of a clinical pathway necessitate the engagement of individuals with diverse expertise and proficiencies, encompassing knowledge translation, research, quality improvement, and analytical skill sets. Clinical pathways are used in a variety of healthcare settings, including hospitals, emergency departments, surgery, long-term care, palliative care, and other community services. They can vary in scale and level and can be specific to acute care, primary care, secondary care, tertiary care, or a combination of these. Pathways can also be specific to certain geographical regions, helping patients to better access the services available in their specific community. A patient may access a clinical pathway when they undergo screening for preventive measures or assessment for diagnosis and treatment planning of a clinical condition. The healthcare provider may initiate them into a pathway or refer them to other providers for follow-up. Once the patient becomes part of a clinical pathway, supplementary resources, such as self-management tools, are accessible to the patient to enhance their provision of care. For more information on clinical pathways, you can visit our website or access the QR code provided. You can also contact us at clinical.pathway@saskhealthauthority.ca. Thank you for watching.